Okay, right. Let's start with the first question again. Could you please introduce yourself and your area of specialty to our audience?
I'm Dr. Joanne, aesthetic dentist. We focus on something that enhances the smile, as small as adjusting the shape of the teeth to something very complex.
Okay, so your patients range from kids to adults, working adults to retirees as well?
Yes, true.
Oh, okay. What inspired you to choose this field of medicine? Dentistry. What inspired you to choose this field of dentistry?
Since student time, I always like to see when patients have gained their confidence after changing their smile.
Oh, before becoming a student of dentistry, how did you know that you want to proceed in dental aesthetics?
Dental aesthetic, actually, I didn't think much before. It's just that when I am going through my studies, I realized I have the passion, enhancing the smile and gaining the confidence to the patients.
So it's something that you discovered after enrolling into this field.
True, yeah.
Okay. Then in your current daily practice, what type of conditions or patients do you most often see? Like, due to what conditions would they come in and seek help from you?
Most of the time, they will come with certain problems they already know, like crooked teeth, discolored or misaligned teeth, or missing teeth sometimes as well. So in that case, we can just move forward and see what we can actually do. Sometimes they are not aware of what they're having. Some certain condition they're not really aware of, where we will actually examine and let them know, and that's how they actually find out what the problems they're actually having right now, and has a smile from there.
What are the common things that when people walk in that they don't usually know they have? Only after getting examined by you, then they realize, oh, I have this issue as well.
For example, they thought they had a very nice straight teeth.
But
when it comes to aesthetic dentistry as a whole and the smile design, we do look at your relationship between the teeth, the front teeth, and your lips, which most people are not aware of. So as we get older, the upper lip kind of goes down. It doesn't show much of your teeth, and that's how you can actually look older. And not a lot of people are aware of that. So when we are examining you, not just the teeth, we do actually examine you as a whole, the whole face and everything, like the proportion ratio, and so that we can give you the best smile.
If their lips are falling, probably means that the muscle is not as strong as before. That's why the lips are falling.
It could be. That could be one of the reasons. Other reasons can be due to the bite. The bite, maybe they're biting like edge to edge, and they're getting treated after some times, which means they're getting shorter. That could be one of the reasons.
So
as well.
A healthy teeth is supposed to overlap
and overjet for at least about 1 to 2 mm.
I see.
But sometimes it will be like edge to edge. Then it can actually cause some attrition of the teeth, causing them to get slightly shorter.
I see.
But the most common one, of course, is due to the age. Then the facial muscle will kind of start drooping down a little bit.
Can that be treated here in terms of facial muscle loosening?
Facial muscle loosening, it will be a little bit difficult in terms of like only fixing them with the teeth. But what we can actually do is enhancing the bite so that the muscles can go back to its like better position.
I see.
And sometimes it can actually have strong muscle. So when you're smiling, without you actually noticing, upper lip is like pulling too much.
So a lot of the gum show. Okay. So it's not only you as a dentist treating their dental condition, they will have to actively make changes in their habits, in their lifestyle as well, when it comes to the structure of their smile.
Yes, true.
All right. Moving on to the next question. What do you believe patients should know before coming to see a doctor in your specialty?
Okay, so before coming to see a dentist or any other kind of field, I believe most important thing is prevention.
Right.
So you should actually come and see a dentist not only when you're having a problem,
Okay.
but in a routine manner where you should actually come back to see us at least every 6 months. And I know a lot of people are not very happy when we say we need an x-ray, but we do need an x-ray because we can only see
The surface.
We don't see what's going on underneath. So
Right.
we don't recommend to take it too often, but routinely, maybe at least 1.5 to 2 years once,
Okay.
it would be advisable to take an x-ray together. Yeah.
Okay.
So when a dentist asks to have an x-ray done,
Don't freak out. It's very normal.
It's very normal.
It's only there to help dentists assess your condition better. So to prevent any future conditions or to treat something that is already pre-existing deep within your gums.
Yes, and also sometimes when suddenly some problem arises, we can trace back. Like, 6 months ago we didn't have it when we take an x-ray. So this is actually like a new lesion.
New acute condition.
Yes, and we can also like trace back to see whether the size of the lesion is getting bigger.
The size of what?
The lesion or any problem.
Uh-huh.
If it's suddenly becoming very big,
Uh-huh.
we can also trace it back.
I see.
Because we have all the records.
Right. So you're advised to do x-ray once every 1.5 to 2 years.
Yes.
And check up once every 6 months.
6 months, yes.
Okay. So that way it's easier to keep track of the progression or degradation of anything that's happening within the oral space lah. Okay. How do you usually reassure patients who may feel anxious about their condition or treatment that they are coming to do?
We, as a dentist ourselves, I'm pretty sure a lot of us feel afraid going to see a dentist.
A lot.
Yeah, even me myself, I'm not very confident going to see a dentist, but for a patient's point of view, when we're doing any treatments, they can't see what we're doing.
Yes.
So I do understand the fear behind. When the first patient come in, when I see the patients for the first time, I always like to go from a routine and very thorough examination and consultation to actually explain what they are having, so that they can actually understand what sort of problems they're having. So at least they will be aware of what we're doing. And I think most of the fear comes from something unknown. So once they know what we're doing, what they're going through, usually I feel like patients can calm down a little more.
Right. Because now speaking from experience, I mean, I have a lot of my friends' parents. They are saying that it's okay, we don't have to go to the dentist because if you go, they are just ready to pluck your tooth out, or like the image that comes to their head is just they're gonna jab your gums to numb and then just pluck something out. That's the common fear with a lot of our clients out there lah. But in your experience, when they come, it's mostly just assessment, just to understand the condition first, and then only make necessary treatments towards certain conditions that they have, right?
That's very true. And a lot of time we don't want to do everything at once. We do like to follow up in a sequence. So we do things like, let's say if there's any emergency, we will deal with the emergency first. Then periodically we will follow up with whatever is needed. So we don't do everything at once.
So it's not like you come in one time and get everything sorted.
No.
It doesn't work that way, right?
No, and I will actually not recommend doing that as well.
Why? Because you want to give certain things to give you some time to recover, or because a lot of patients, they fear coming into the dental clinic, and if they really have to do it, they just want to come in, do it once and get over with it. They don't want to come back anymore.
Understand, but not everyone is having all these minor problems. Sometimes they do have different problems in different teeth or even in the gum. So what we usually do is if they have anything that is causing them some problem or the pain, we will treat them first, then go on with the gums. Then if there's any decays, any active disease, we will deal with them first. And for example, if we have problems like you're having a night clenching, then we will also have to do that together. And follow-ups are also very important. So although I understand you don't want to come to see us very often, it will be much better not doing everything at once, but coming back periodically and do things little by little. will be much better, better for your wallet as well.
I see. Oh, really?
Right, because one shot it will cost you a lot.
A big amount. Okay.